Hello, I'm Rose Sherwood, and this is The Current on CBC Radio 1. Continuing with our tribute to Mental Health Awareness Week, today we cover another story looking at the newest research in the area of mental health. In this segment, we will be discussing a topic I'm sure everyone can relate to: anxiety. According to a graduate student research team at Ryerson University in Toronto, when trying to determine why some people experience anxiety and others do not, the answer may lie in what we eat. Carrie Miller is a member of the research team that recently published an article entitled Investigation of Omega-3 PUFAs and Anxiety, a Systematic Literature Review, in the Journal of Dietetic Research. She joins us today to talk about her findings. Hello, Carrie.
Hello, Rose. It's great to be speaking with you today.
Well, thank you for coming on the program. Now, we will get to discuss your research question, but first, I am curious to know why you chose to investigate this topic. Why mental health and why anxiety?
Well, Rose, I've always had a research interest in the area, but in the past I've also watched family members struggle with mental health issues, so I'm passionate about finding ways to help improve quality of life for those affected individuals. Speaking to the second part of your question, my team and I focused our research on anxiety specifically because disorders of this nature are the most common mental health problem affecting Canadians. Therefore, we felt more priority should be given to learning about how we can prevent and manage anxiety.
Really? The most common mental health problem in Canada. How many people are living with anxiety?
Just over 4 million Canadians.
Wow, 4 million, that's a large number. And you mentioned that we need to know more about how to manage and prevent anxiety. What strategies are currently used and why are they not effective?
It's a great question. Treatment often involves a number of things. Any combination of counseling, medication, or lifestyle changes to help with coping, like exercise, for example, are often used. But every individual is different and will respond differently to certain treatments. If nutrition therapy is found to help manage anxiety, then being able to also offer this option to Canadians would only add to our ability to care for these individuals.
I agree. The more options, the better. Now, let's talk about nutrition. You chose to look at how omega-3 PUFAs relate to anxiety, correct?
Yep, that's correct.
So, can you explain to our listeners what exactly omega-3 PUFAs are? They sound like a fraternity name or some kind of computer technology to me.
Yeah, the name does sound a bit scientific, but all omega-3 PUFAs are is a type of healthy fat that we need to get from the foods that we eat. The majority of Canadians are not getting enough omega-3 fats from their diet. This is often because omega-3s are only found in a limited number of foods, like fatty fish like salmon and trout, walnuts, flax seeds, and soybeans, for example. For those individuals not getting the recommended amounts of these healthy fats from foods, there is another option. Supplements, which are a concentrated source of omega-3s, can also be consumed in a pill form.
Okay, so omega-3s are a healthy type of fat. Linking back to mental health now, how did you make the connection between omega-3s and anxiety?
Well, the human body needs omega-3s for many functions, like inflammation and immunity, but what makes them special is the role they play in maintaining brain and nerve function. Some studies have actually shown omega-3s may help prevent conditions like Alzheimer's disease and age-related brain decline. But more importantly, recent research has shown that a higher intake of omega-3 fats helps to reduce depression. Now, anxiety is typically found alongside depression, but anxiety can cause a great deal of personal stress and be seriously debilitating all on its own. So the question my research team and I wanted to answer was, could an increased intake of omega-3 fats also help treat individuals who are not clinically depressed, but are experiencing severe anxiety?
All right, let me just make sure I'm clear on this. Consuming more omega-3 fats reduces depression. Because anxiety is related to depression, you wanted to see if consuming these fats could also help people experiencing severe anxiety.
Exactly.
Well, I guess that leads into explaining your research process. What did you and your team do to answer this question?
We performed a systematic literature review. Basically, what that means is we gathered all the relevant research out there on the topic of omega-3s and anxiety. Then we analyzed our findings and summarized the evidence to paint an overall picture of what the research was saying.
It sounds like quite the process. Now, we're going to have to take a quick break for a few words from one of our sponsors, but I can't wait to hear about what you found when we come back. And remember, callers, if you have a comment about this topic, connect with us toll free at 1-877-514-4321. We'll be right back.
Introducing the Shelley Alexanian Signature Collection. Carpet, hardwood, and window coverings created to my own standards, so you can be assured they offer impeccable durability, design, and value, or I wouldn't put my name on them. Come and share my excitement for design and shop my Signature Collection today.
The Shelley Alexanian Signature Collection, exclusively at Alexanian's, on sale now.
Welcome back, listeners. For those of you just joining us in today's segment, we are talking to Carrie Miller, a researcher from Ryerson University, about omega-3 fats and anxiety. Now, Carrie, what did your team find? Should I go out and buy myself a whole salmon tonight to reduce my anxiety?
Well, this area of research looking at the link between omega-3 fats and anxiety is very new, so we found a limited amount of evidence. We were able to source 9 research studies to analyze, and on a whole, they did suggest consuming higher amounts of omega-3 fats may lower anxiety levels. But we ultimately determined there is not enough definitive evidence right now to be sure. The bottom line is that more research is needed before we can recommend omega-3s as a treatment method for anxiety.
So the research looks promising, but you can't confidently say that omega-3 fats reduce anxiety.
Correct.
I feel like I hear that a lot with nutrition in the media. Before we can support this new nutritional therapy, more research is needed. Why is the evidence not strong enough in this case?
Well, we were able to gather data from 4 high-quality experimental trials involving a total of 445 participants. In these trials, the participants received omega-3 supplements in capsule form compared to a placebo or a dummy pill. Only 3 of the 4 studies found that those people given the omega-3s reported lower anxiety than those given the dummy pill. And within these 3 studies, there were important limitations that undermined our confidence in the results. We also considered 5 lower quality observational studies where all the research linked higher omega-3 intake to reduced anxiety. But again, there were important limitations, so we couldn't be confident in these results either. In addition to all of this, there were many differences among the type of people studied. For example, some research was done on only men, others on only women, some on healthy adults, and others only on substance abusers. Factors like this make it really difficult to provide treatment recommendations because the results can't be related to all Canadians. Before healthcare providers can give the green light to their patients to consume omega-3s for anxiety, we need to know more. For example, what types of omega-3 fats and what doses are required for the positive results. We just don't have that information yet.
Well, you raised some very good points there. I guess we just need a few more questions answered before we start seeing doctors prescribing omega-3s for anxiety.
Yes, we do. That being said, in all the studies we reviewed, omega-3 supplement doses of 3 grams per day or less didn't cause any harm. Only minor side effects like nausea were ever reported. At this point, we don't know how much omega-3 fat people need to consume to see anxiety benefits, but if you're still keen to try nutritional therapy, you can safely consume supplements at doses of less than 3 grams per day. Or if supplements aren't of interest to you, then simply focusing on getting more omega-3 fats from foods that you eat is another option.
That's great to keep in mind. Carrie, thank you for your ideas and sharing your work. Relating nutrition to mental health is fascinating, and we wish you the best of luck in your future career.
It was great to be with you.
So after listening to Carrie speak, are you going to try upping your omega-3 fats in your diet to prevent or reduce anxiety? I think I may save my money and just go the food route. But listeners, let us know. Or if you have any other comments about this topic, connect with us toll free at 1-877-514-4321. That's our program for today. Stay tuned into Radio 1 for The Q. I'm Rose Sherwood. Thanks for listening to The Current.